Hello, my name is Justine Cole, and the type of impulse control disorder I have chosen to discuss today is sexual compulsions. The name I have chosen to give my organization is called Impasse. Here at Impasse, we offer seminars, classes, therapy, and rehabilitation sessions to those with a diagnosed sexual compulsion or individuals on probation for a sexual misconduct limited to indecent exposure, fraudicism, which is the touching or rubbing against a non-consensual person, pedophilia, the sexual activity with a pubescent child, voyeurism, watching a person naked, undressing, or engaging in sexual activity without the knowledge of an individual's presence, or zoophilia, engaging in sexual activity with animals. My role here at Impasse is to overlook the different classes and evaluate the treatment process to ensure clients' needs are met, whether that be correct form of therapy is being used to meet clients' needs or comfortability in the type of therapy being used. I also confirm that all measures are being taken that the courts mandate for their probation. There has been research relating to sexual compulsions, but many of the research was done by male-only samples. It is said to be rare when a female possesses a sexual compulsion. There could also be trouble with research about sexual compulsions because of the honesty you have to rely on. There are records taken when a person is incarcerated for a crime related to sexual compulsions, but may not be the only crime that person has committed. Sexual compulsions can not only greatly impact the person diagnosed, but also the people around them. In 2019, there were 40,796 arrests made for sexual offenses not including rape or prostitution, but including indecent exposure, pedophilia, voyeurism, and zoophilia. In 2018, there were 46,937 victims. There are innocent people, approximately around 40,000, that are victims of a sex crime, and there may be more out there that have not been heard. Here at Impasse, we want to make it possible for someone with a sexual compulsion to feel safe speaking up and seeking help to help lower these numbers. Some may not seek help because they are embarrassed about their urges and one day may act on them and hurt someone innocent. With the right help, with us here at Impasse, we can help you better understand yourself and those urges and help protect the people around you. The chart below shows the arrests made from someone having sexual contact with an animal. The chart ranges from 0 to 300 and then 1975 to 2015. From 1975 to 1980, there was only 3 arrests made, and then concluding to 2015, it skyrocketed to 259. Here at Impasse, we offer both private and group therapy sessions. We do separate men and women at this facility during group therapy sessions due to the topics being discussed. There are 2 facilities, one being used for the individuals participating due to an arrest, and the other facility for individuals seeking treatment on their own. This facility also offers space for a 12-step program if there is an interested party. The therapists often use cognitive behavioral therapy, but may differ at the therapist's discretion. Impasse also offers marriage counseling for those in relationships and family therapy to help the patient, but also their families in understanding their disorder. The reason I chose to do sexual compulsions is that it is important that everyone gets the help they need and deserve. It is not an easy topic for a lot of people to choose, and many others are. I find sexual compulsions very interesting. It is an impulse that is very dangerous and if not treated properly, can have serious consequences. I would like to focus on sexual compulsions and addictions when I am done with school, and this presentation is a great way to further my insight. Sexual compulsive behaviors can be defined as an excessive preoccupations with sexual fantasies, urges, or behaviors. These urges can be difficult to control, causing you distress or negatively affects your health, job, relationships, or other parts of your life. There are 2 main types of sexual compulsions. Paraphilias and paraphilia-related disorders. Paraphilias consist of intense sexual urges that can be fantasies or behaviors. There is usually a non-consenting person, object, or the humiliation of another human being. To gain the diagnosis for paraphilia, these urges need to have lasted 6 months or longer, cause significant distress, or have trouble functioning. And these urges has to have been acted on a non-consensual party. Paraphilia-related disorders, sexual urges that are considered to be normalized, can lead to distress due to an intense need. Some co-occurring issues that can be presented to someone diagnosed with a sexual compulsion could be loss of a job. This relates to paraphilias because of the impulse one can get sexually aroused at the workplace and act on those impulses, causing sexual harassment to other employees. This can be related to a related paraphilia disorder. One can get the urge to masturbate, look at pornography, act promiscuously, or make sexual remarks towards another employee. This could also lead to a loss of relationship. Relating to paraphilias, to gain the diagnosis for paraphilia, these urges need to have lasted 6 months or longer, cause significant distress, or have trouble functioning. Those urges has to have been acted out on a non-consensual party. The partner to the individual diagnosed with paraphilia could have been the victim of one of these urges. The partner could also not agree and or accept the sexual nature of the individual. This relates to paraphilia-related disorders. The type of sexual fetish the individual possesses may not be similar to their partner's because of the nature of the acts. This could cause tension in the relationship, not being able to connect in the same way sexually. It could also lead to incarceration. Relating to paraphilias, these urges can escalate past a fantasy and be criminal. Some issues that can also be caused is moral ones. For example, the feeling of guilt from the thoughts of adultery, and the thoughts may not represent religious beliefs and may cause feeling of sin.